Hi, my name is Heather Ramos, and I'll be performing the insertion of a Foley catheter. I'm in my school uniform with my school badge. I have no facial piercings, and I have no artificial nails or nail polish. You enter patient's room and close door for privacy and perform hand hygiene. Hi, my name is Heather, and I'm going to be your nurse today. Can you please tell me your first, last name, and date of birth? Check patient's wristband and verify 2 patient identifiers. All right, Ms. Smith, thank you. We're going to go ahead and doctor has ordered a Foley catheter for you. So I'm going to get you cleaned up. Half of this procedure is going to be a sterile procedure, and I'll let you know when we get to that part. I'm going to need your help. So I'm going to lay you flat back, but I need you to bend your knees, open your legs, and have your feet facing an opposite direction. Okay, I'm going to get you cleaned using some non-rinse soap. Do you have any questions for me before we begin? Okay, and do I have your permission so that way I can touch you? All right, thank you. So I want to take note that I am right-handed. I'm standing to the right of the patient. This is patient's right hip. I have my track receptacle, my Foley kit, washcloth, and some clean gloves. Okay, Miss Smith, I'm going to lay you flat back, okay? All right, so let's get some clean gloves. Go ahead and bend your knees, open your legs, and spread your feet in opposite directions. I'm going to get my washcloths. I have 2 here. I'm going to use one corner. All right, Miss Smith, I'm going to touch you now. I'm going to spread open your labia, okay, so I can get you clean. So spread patient's labia open. Use one corner of the washcloth here, and you're going to clean from the furthest labia from you from top to bottom. All right, switch to a different corner and clean the labia closest to you from top to bottom. Switch to another corner one last time, and you're going to clean directly down the center, top to bottom. Go ahead and toss this. Use your second washcloth now. We're going to go ahead and dry the area in the same fashion. Furthest from you, from top to bottom. Switch corners, closest to you, from top to bottom. One last corner, and we're going to dry directly down the center again, top to bottom. Go ahead and toss. So we're going to examine the patient at this point. We're looking at the perianal area. We're looking at the urinary meatus. We're examining for any foul odor or discharge, and we're ensuring that the skin is intact. Okay, Ms. Smith, we're transitioning now to the sterile part of the procedure. I'm going to raise the bed up. Feel comfortable working tight, about waist level. Toss my gloves. I'm going to take off my badge, place it in the lower area. I'm going to perform hand hygiene. I'm going to take my catheter kit and I'm going to place it in between your legs. So please do not touch any of the items that I'm placing in between your legs. Ideally, the kit should be in between the patient's legs. If not, bedside, flat, clean bedside table would be appropriate. So take out the catheter kit here and then toss. Place that in between patient's legs. Let's use this 1-inch border here that you can touch. You're going to open up the flap forward to the side, other side, and the last flap goes towards you. All right, so take the gloves out. Arrow facing towards you. Let's open this up. I'm going to use the 1-inch border to move this. So that way you can see all 4 corners. Good. All right, start with your non-dominant hand. For me, that is my left. Pinch the outer cuff of the sterile glove. Work your hand in, okay? You're gonna take these 2 fingers, work it underneath the other inside of the cuff, like this. Bring it down, ensure for tightness. pinch the center of the sterile wrapper away and discard into the receptacle here. I'm going to position my box, my kit, to a better working area. Okay, Ms. Smith, what I'm going to do is place a drape underneath your Purulania area. Go ahead and help me out by pushing down with your feet and lifting up your hips. Grab the corner. Okay, 1, 2, 3, hips up. Okay, this is underneath patient's hips now. I have a fenestrated drape. It is ripped for prior use. Ideally, it would not be ripped, but you're going to open this up and place it around the patient's area here. Get it? Okay. Shiny side down, both of the drapes. Okay. Blue drape, shiny side down, underneath patient's perineal area. Fenestrated drape covering. You have a sterile field now. Take the lid of your kit, place it out. Get your alcohol swabs out and face them towards you. Toss lubricated jelly, open. Okay, toss. Then we have your sterile water syringe. Take the lid off and toss. Some of my sterile fluid is missing from prior use, and about 6 cc's of sterile fluid remaining. All right, so we have the catheter sheath. Carefully remove. And then you go ahead and set about 2 inches into the lubricating jelly in the tray. Okay, now take a portion of the catheter out and have that ready to press. Take your sterile syringe fluid and push it into the port firmly. Okay, Ms. Smith, I'm going to spread your labia open just like I did before, and I'm going to clean it this time with alcohol swab, so it's going to be a little bit cold, okay? Go ahead, take your non-dominant hand and spread open the labia. Use 1 alcohol swab and in 1 clean motion. Go from top to bottom, the furthest labia from you. Go ahead, discard. Use your second alcohol swab. Clean the labia closest to you from top to bottom. 1 swipe. Toss. Your third alcohol swab is going to go directly down the center from top to bottom. You're going to toss that. Okay, again, you're going to visualize the urinary meatus at this point. Okay, Ms. Smith, we're going to get the catheter inserted. What I'm going to have you do is take a nice deep breath in, and then when I insert it, that's when you're going to exhale, okay? I'm going to grasp the catheter about 2 inches or 5 to 7.5 centimeters. It's lubricated right here. Okay, Ms. Smith, go ahead and take a nice deep breath in. Okay, and go ahead and exhale. The catheter has been advanced 2 inches and the urine flow has been observed. At this point, I'm going to advance 2 more inches. Okay, I'm going to take my non-dominant hand and hold this tight, and I'm going to push the 10 cc's of fluid. Okay, here we go, Ms. Smith. Okay. Are you feeling any abdominal pain or cramping? Okay, good. We're almost done. You're doing good. Okay, last cc has been administered. Go ahead and disconnect the syringe from the port. Put it in the tray. I'm going to pull until I meet resistance. Okay, resistance has been met. Let's go ahead and get you cleaned up. I'm going to clean the lube off of you here. So take your fenestrated drape and just clean the patient up. Okay, toss. You can get rid of all of the other remaining items now. Let's get the catheter out of the box. Okay, go ahead and lift up your hips. Great. Good. All right, I'm going to fasten this to your leg. Okay. Now I'm going to clip this bag to the bed. Okay, it's been fastened to patient's leg. The bag has been clipped to patient's bed. I'm going to go ahead and remove my gloves. I'm going to sit patient back up. I'm going to perform hand hygiene. Okay. Put my clip back on, my badge back on. Raise patient up to comfortable position. Ms. Smith, this catheter is attached to your leg and the bag is attached to your bed and it must hang below your bladder. Please allow yourself some slack. Do not tug or pull. It shouldn't be too tight. Okay, it is a leak hazard. If you need anything, please hit the call light button and I'll come back and I'll help you. Okay? So patient has been educated. She is back in a comfortable position. Hand hygiene has been performed. The last step of this procedure would be documenting in the patient's chart and also documenting how patient tolerated the procedure. Thank you.